How do I look after my temporary teeth? So in the first month after surgery, we recommend liquid foods. The way I explain it to everyone is it's like being a baby again. Your first month is you're a newborn, your second month you're a toddler, and your third month you're a teenager, and you can eat whatever you want then. So in the first month, it's all things that are no biting, you can just swallow. So soup, scrambled eggs, porridge, ice cream, yogurt. Because the teeth are ceramic, you can't get decay, so you can have as much sugar as you want, but just make sure it's soft stuff. You also can clean them normally with a toothbrush. Ideally, we recommend a soft toothbrush, and you can use toothpaste. It does help to kind of get rid of some of the stains. And mouthwash is super important, twice a day, because that's what makes it really stay clean. We really emphasize that for the first week or 2 weeks at least, you should avoid smoking if you are a smoker, and that also you should be careful about what you eat. There should be nothing that you're biting into, and we also usually provide a mouth guard for you to wear at night time in case you grind your teeth, which can risk them breaking. What we advise people of is that teeth can sometimes come loose because these are temporaries and they're designed to protect implants. If this happens, just contact our practice. We'll arrange to see you as soon as possible and we can retighten them down and there'll be nothing to worry about.